Good afternoon, everybody. This is about the electronic hospital information system at the District General Hospital Trincomalee in Sri Lanka. Poor quality hospital data can be fixed with very expensive, sophisticated software solutions. High quality, reliable, and timely hospital information system is the foundation of better decision making. Implementation of electronic health information system would be a serious challenge, and in Sri Lanka, with the epidemiology unit and collaboration with the World Health Organization has implemented several softwares and implemented in several hospitals, but most of the softwares were failed due to very complicated systems, and none of the systems have been evaluated completely, and assessment of the present health information system using the health matrix network tool says it is not very much up to the standard. So interventions are necessary to improve the present state. These manual records, like before recording, this you can see the compilation of lot of records, and how the space, it needs a lot of space, and it is very much complicated. But after implementation of the electronic health information system at the Trincomalee, it is functioning. It has a fully functioning OPD with a paperless system. As the country is aiming towards e-health and paperless hospital information system, it is important to study this system, why others failed and this is functioning very successfully. My objectives are to describe the electronic health information system, and this is a cross-sectional study. And main outcome measures, like this software multi-disease surveillance system has undergone several changes, about 5 times, and it was completely a paperless system now running at the OPD in District General Hospital Trincomalee, and the system was password protected, and each member of the staff was given a password, and it has a graded exposure to the staff. Medical officers has full access, and others like attendants and nurses and pharmacists have the limited access to the system. Medical superintendent of the hospital has the full authority to the system, and he can get all the informations in one click, and also can respond to the queries online. The OPD is paperless, no pens, no lab requests forms, no prescription forms, no certificates and all, diagnostic cards and all. Here you can see the outpatient registration where no records, only the patient coming with the number, and this admission registration, admission clerk will give the PIN number, PID number, patient PID number. So this is the paperless registration desk, and a competent doctor can enter details within half to 1 minute, and competent nurse can enter within 15 to 20 seconds, and attendant can who is familiar with the system can enter details within 40 to 45 seconds. Doctors were able to order investigations, X-rays, radiological images, prescriptions online. Radiological images can be available online, so reduce the cost of X-ray films. Patient can get their radiological images copied to the CDs. The hospital statistics generated by the system, outpatient module, earlier there were no recording system at the OPD, like OPD disease morbidity pattern, we couldn't get the OPD morbidity pattern. But in this case, with this system, Now we can get the OPD disease morbidity pattern easily. It is saved in the computer network. And top 10 diseases at the OPD entries, and the patient list also. Inward module, daily midnight reports, IMMR, they can produce with the system. General use of the electronic system, medical officers use 100% use the system to write prescriptions, get the patient's social demographic details, history and the previous medical records, and obtain what drugs available and what drugs not available at the OPD. And also for the notification of diseases. More than 70% of them use this. 50 to 70% of doctors use to get the laboratory reports, radiological reports, and patients to get the disease morbidity pattern at the OPD. This is paperless OPD doctors using the system. Nurses use the system less than half of the tasks which the system was functional. Pharmacists and the dispensers use was the optimal, and the attendants about half of the tasks out of the task which was the system was functional. Most of the members of the each category of staff agreed which this is easy to use, and overall respondents' competency of using the system was high. It is more than 80%. This is the admission desk. Pharmacy, the pharmacist using the computers to give the drugs. Most of them are agreed that the electronic hospital information system is worth the time and effort required to use it. And most of them are agreed the quality of the work at the OPD has increased after the installation. And user satisfaction, I inquired with 5 factors, that is content, accuracy, format, ease of use, and the timeliness. And overall score is it is about 32.5 to medical officers, 42.1 to nursing officers, like 32.5 to pharmacists, and 42.3 to the attendants. Assessment of the computer literacy also, the mean total score of the medical officers was 66.7, nursing officers 46.7, pharmacists 42.2, attendants 47.8. Conclusion, the majority of staff was competent to use the system. Though the computer literacy is low, they are very much competent on using the system. MDS software which was installed at the OPD in Trincomalee is user-friendly and easy to learn. The system was password protected, and the system provides confidentiality and the security of the patient information. Pilferage of drugs has been reduced. This is the implementation of the electronic information system at the OPD is an example of the successful implementation. The system has some constraints and need to be upgraded. Like doctors rarely look at the patient's face, but they look onto the screen always. That is the main complaint gives by the patients. Recommendations at policy level, we have to legalize the electronic health information system and the acceptance of electronic records by the courts. Otherwise, we have to maintain the paper records, even because the courts will accept only the papers. And the operation level, to strengthen the training programs and combat several constraints from the upgrade the system, and entering lab, like provide digital X-ray imagings and download them to CDs and give to the patient, and improve the system to write diagnosis according to ICD-10. My final thought is, don't let perfect be the enemy of good. Don't try to get everything exact right from the beginning, because you won't. The important thing is to be able to evolve the electronic health information system over time with the experience. Thank you.